Really well, excellent.
But was the WHO-led fact-finding mission really going fine? Investigators looking into how the pandemic started now say their trip to China was plagued by delays and a lack of access. They'd requested raw patient data on the 174 COVID-19 cases China had identified from the beginning of the outbreak in Wuhan in December 2019. But the team was only given a summary.
In the ideal world, you would go through it patient by patient by patient. And that's what we call a line listing. Now, obviously, all of that stuff is anonymous. You don't want the patient names or anything, but you want the details on, what were the questions asked, what were the responses, and what were the sort of analyses of the data. And that's standard practice for an outbreak investigation.
The team arrived in China in January. It spent 4 weeks there. But the first 2 weeks were spent in mandatory hotel quarantine, and visits later were all organized by their Chinese hosts. The scientists were prevented from contact with the general public due to health restrictions.
We still are far away from understanding the origin and identifying animal species and all the pathways from which the virus could have entered the human in December. We knew from before going there that it would take a long time and a lot of efforts to get there. So it's just the start, but we have made a lot of progress.
The WHO team is still pressing Chinese officials to conduct checks of blood samples for signs that the virus might have been circulating earlier than December 2019. It's also asked Beijing to thoroughly investigate the wildlife trade in Wuhan for clues on how the virus might have jumped from animals to humans. But the experts say there were times they butted heads with their Chinese counterparts.
Well, you've got limited bits of information. How do you put those together to work out the origin? There were differences of opinion about the significance of data and so on.
Although the WHO team is still waiting on more data from China, it's expected to release a summary of its findings as early as next week. Natasha Hussain, TRT World.